Carotid artery palpation. So common carotid artery is an artery which begins from brachiocephalic trunk on the right side, whereas directly from arch of aorta on the left side. They ascend into the neck behind the sternoclavicular joint and goes straight up to the level of thyroid cartilage at the anterior border of sternocleidomastoid. So if you just ask the person to tilt their head towards one side, you can see the sternocleidomastoid becomes more prominent. So here on the inner border or the anterior border of sternocleidomastoid, take the middle three fingers, point it backwards, press deeply without hurting the patient. Then you can feel the carotid pulsation. It will be tapping your fingers now because we are palpating the common carotid artery onto the carotid tubercle, a tubercle on the anterior surface of C6 vertebra. So always palpate on one side, because if you press on both sides, blood supply to the brain will be hampered and the person will get giddiness and they may collapse. So kindly palpate on one side. Carotid, the word carotid is derived from Greek and Latin term. Carotid means sleep, meaning when they used to massage over here in ancient time, that time the person used to get sleep. If you press both sides, permanent sleep. So this is about carotid artery pulsation, how to feel about carotid artery pulsation. So whenever the peripheral pulse is not palpable, like the radial artery pulsation lateral to flexor carpi radialis, if it is not palpable, the dorsalis pedis artery palpation lateral to extensor hallucis longus, if these are not palpable, then we should check for carotid pulse, the central pulsation. So when the peripheral pulse are feeble, in extreme temperature they will be feeble, or extreme cold because of frostbite, and decreased circulation will be there in the periphery. So radial artery pulsation and the dorsalis pedis artery pulsation won't be there. That doesn't mean the person has died. We just have to give warmth to the person with a warm towel and insulate the patient and feel for the carotid pulse. If it is present, that means there is no need of giving chest compression for compressing the heart. If it is absent, then we have to start CPR, that is cardiopulmonary resuscitation. You have to start compressing the chest. The heart will get compressed between the compressing hand and the vertebral column. So you are making a heart to pump, which has been stopped. So this is how the carotid artery pulsation feeling and how it helps in analyzing the case. Thank you for watching and learning from Logic Medico. If you are new to the channel, kindly consider subscribing. Thank you. Have a good day. Bye.